Dr. Sonia please come in over?
Okay, Dr. Sonia to Medic 1. Proceed.
Doctor, I got this one road traffic accident. Doctor, I'm actually bringing the patient straight to emergency now.
Okay, alright. Are you safe from danger? Are you away from danger?
Yes, Doctor. I'm already on my way, bringing the patient now to you.
Okay, how is the patient's response to you?
The patient is not responding to me, Doctor.
Not responding. Okay, is the airway patent? Is the patient any stridor, any gargling sound, any obstruction with the airway?
So far, when I assessed, Doctor, I couldn't appreciate any.
Okay, alright.
He seems fine.
Okay, he's unresponsive. Can you put on cervical collar?
Yes, that has already been applied, Doctor.
Okay, alright. What about the pulse volume, BP, vital sign? Have you got anything?
Okay, the BP is 90 over 40 millimeter mercury.
Right, okay.
Heart rate is 135 beats per minute.
Alright.
SpO2 is unrecordable, Doctor.
Okay.
Neurological status, the patient is just responding to pain only.
Okay, I understand you're a paramedic. Can you put a LMA or can you put a high flow mask?
Okay, I'll try, Doctor.
Can you put a high flow mask, maintain his airway, put a jaw thrust if you cannot open the airway, put in an alpha oropharyngeal airway. Okay, and then please put in large tube bore and then run IV drip normal saline while you're on the way here.
Okay, Doctor.
Okay, alright. And put on the spinal board as well because you're transporting this patient, right? Okay, I'm going to tell my team now. What's your ETA?
My ETA is 5 minutes, Doctor.
Any hazardous material?
So far, no.
Okay, so your ETA is 5 minutes, right? Okay, only one victim, right?
Yep.
Okay, alright. Thank you.
Right, Roger now.
Okay, team, we have body trauma coming in. Okay, this patient was found at the roadside. We're going to anticipate the polytrauma and multiple organ injuries. I need you guys to prepare your emergency trolleys as well as your resuscitation bed. Warm saline must be prepared, then the pack cells must be available, right? Chest tubes and all the difficult every trolley must be there as well. Okay? What else you want to prepare?
Prepare for the to secure the building and look out for Tom FC.
Okay, right.
Chest tube, needle troposis and cardiosynthesis.
Right. Okay, we only have one victim. Alright, make sure all the immobilization is available. All this procedure must be done in aseptic technique. Okay, don't forget that. Make sure we save. Everybody has a basic PPE.
Already applied.
Okay. Right. Everybody ready? Anyone who want to add anything?
No, Green. Thank you.
Okay, have a nice
He's not responding.
Okay, I
open
the way.
Okay, alright.
With the jaw transmitted.
Okay. Zaizo, get ready the suction. We're going to do a suction for this patient. Gets gargling sounds.
Session. I do the session. Any gargle sound, any foreign body, any
Okay, there is no more gurgling sound now.
Alright.
any get reflex,
What is that?
get reflex.
There is no get reflex.
Okay, team leader, no gargle sound, no get reflex.
Okay, alright.
Okay,
Please do a C clef. Okay, get ready oropharyngeal airway. Okay.
The bed.
Prepare for the intubation for this patient because we cannot protect the airway. Manual banking is done.
SpO2 is still unrecordable.
Okay, alright. Manual banking, please. Right. Can you please run through it? Okay.
Okay, team leader, the
Suction,
intubation set is ready.
Okay, can I get the vitals for at this point?
The vitals at the moment now 70 over 40 millimeter mercury. Heart rate is 140. SpO2 is still unrecordable.
Alright. Saturation is still unrecordable, right? Okay, alright. It's okay. Can we do a manual bagging, right? Continuous manual bagging, okay?
Okay, team leader.
Alright. Okay. Can we proceed with intubation?
Okay, can.
Okay.
I am ready.
Alright. Okay. Proceed with intubation, yeah?
Intubation, okay, team leader.
Alright.
Okay, team leader, I intubate with direct pressurization.
Okay. Okay, all right. Under direct visualization, EPT has been inserted.
Yes.
Okay, all right.
To be inserted. Okay.
Okay,
Team
can
leader
you
will
please-
check the placement of ETT. Checking the placement.
You didn't hear anything?
Can you please push the air?
That's the stomach, right? So we do
There's
the
nothing there.
Okay, there's nothing.
chest. What about the chest?
Present.
Present.
Equal. Equal.
Present.
Okay, all right.
Okay,
Okay,
the
Rizal,
good.
I need you to take care of the airway. All right, continuous, put it on ventilator for this patient. Continuous
Okay,
suction. Make sure this airway is always patent. There's a lot of gurgling just now. Make sure the secretions are all cleared, right?
Okay,
At all
leader.
times. Okay, Zaizal, let's proceed
Okay,
with the
team
breathing
leader.
examination.
Okay, checking for the trachea.
Okay?
Is the
Trachea is deviated to the left.
Okay, all right.
inspection, is there equal chest rise?
There is reduced chest rise over the right side.
Right.
Any open chest wound, any open bleeding?
The injury is like what you see.
Palpation over the left side.
Crepitus.
There is crepitus over the right side.
Okay.
Chest extension. Chest spring over the left side and the right side.
Chest spring is positive over the right side.
Right.
Percussion.
Hyperresonant over the right side.
Okay. How is the vital sign at this point, Ain?
With your intubation, the SpO2 is recordable now at 70%.
Right.
His BP is still low at 60 or 40.
Okay.
Heart rate is 140.
Okay. The BP is still low. Patient is having right tension pneumothorax. So how are you going to decompress it? Put in a leader thoracostomy now.
Leader. And clinically the leader thoracostomy set.
Can you send the EVP as well? Okay. Right. All right. Okay. Have you prepared the large monitor? Okay. Procedure must be done. Okay. Aseptic technique, yeah?
Okay, we go to leader.
Zaizal, what's the service and the technique?
Putting the alarm code
Right.
and replicate the first of air from the leader thoracosynthesis.
Flash of air, appreciate.
Okay. Rabiatul, have you prepared the chest tube?
SpO2 is now 90%.
Okay, all right. Zaizal, can you proceed the chest tube insertion on the right side?
Go to the technical sponge door and underwater seal as well. In leader, I would like to proceed with the chest tube
Okay, all right.
and the safety triangle.
Okay. Your chest tube inserted on the right side and the safety triangle, right? Okay. What size did you prepare? 36 French prepared for chest tube.
Okay, to leader, I do the dressing irrigated
dressing,
and the
set.
okay, and I also apply the direct bandage for the
Okay.
stop the bleeding.
Very good. Okay.
Securing the chest tube. Give me the chest tube, sir.
BP now is 50 over 30. Heart rate is still tachycardic 100 over 40.
Setting the chest tube over the right side. Is there any bubbling over the
A lot
chest
of
tube?
air coming out. Go, 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 go. And
Any-
BP now is 70 over 40.
Any
Heart
blood
rate-
came out from the chest
No
tube?
blood.
No blood.
Okay, the BP. Okay, all right. Boxerman, right? Okay, can you get a Paxel in now? Okay, so the blood, okay, there's blood coming out from the chest, right? Okay, and it's bubbling, right? Okay, all right. So let's proceed with the
Okay, abdomen strong. No distension, no blooding appreciated.
Can we check for the heart sound, please?
The heart sound.
Where are you checking for the heart sound? Okay.
Checking the heart sound.
Okay, the heart sound is present.
Okay, it's not muffled. It's not. It's a normal heart sound. All right. How's the CRT?
CRT is prolonged 4 to 5 seconds.
Okay. All right.
Team leader, I already transfused one pint.
Patient is still having clots for shock. We need to transfuse products, pack cells for this patient.
Okay.
Rizal, I need you to call the NS, cardiothoracic as well as surgical team because this patient is having a thoracic injury.
Okay, team leader.
You the patient has a operation over the left side.
Right.
Now intubated and also the
Okay, have you done a compression bandage for this
Done,
patient?
done already.
Okay, irrigation done?
Done.
Okay, with what you irrigated the patient with?
I wait normal salam with Pomidon.
Okay, how is the pulses, distal pulse volume?
Pulse is absent.
Absent, okay.
I would like to reposition the patient's head with the faster 7 after the reposition. Team leader, I already informed the NS and team Torako.
Yes.
Surgical Torako.
All right.
Okay, reposition the leg and pipetting back the pulses.
Okay, the pulse is present now.
Okay.
Team leader, the pulse presence now.
Very good, Zaizul. Is there any more bleeding from the gauze here? Is the gauze closed?
Bleeding from the medullary of the bone.
Okay, it's still continuously bleeding, yeah? Okay. So we should elevate the leg.
Okay,
Right?
very good, team leader. Elevating the leg.
Okay, elevate the leg, right? Slowly, right? Okay.
What gauze?
Let's assume that's done.
Okay, how is the bleeding after the elevation of the leg?
It is still bleeding from the exposed bone.
Okay, all right. So we're going to compress it more, and then we're going to do a pressure point compression, right? Okay, identifying the femoral artery.
Okay, very good, team
Zaizul.
leader. Okay, I'm compressing the femoral artery.
Okay, how is the bleeding after the compression of the
Bleeding is reduced.
All right, okay, good. Okay, continue with the compression bandage.
Yes, indeed.
How is the BP at this point of time?
EP right now is after you put the compress there, 90 over 40.
Okay,
Heart rate
good.
is still tachycardic 120.
Right.
SpO2 is 100% on mechanical ventilation.
Okay, fluids has been put in 2 points PEC, warm saline has been gone in.
Saline in.
Currently, SAFO is running. We are waiting for the
SAFO in,
PEC
Team
cells cross match.
Yes.
We are going to continue to aggressively resuscitate this patient, right?
Okay,
BP has slowly picked up. Okay, can we check the pelvis, please? Okay,
Checking the pelvic.
is the pelvic spring positive or
Negative.
Negative, right? Okay, is there any scrotal hematoma?
There is no evidence of pelvic injury.
Right, okay. Any other long bone injuries? Any other hemorrhages that we are not seeing here?
We do not see any visible hemorrhages anymore.
Okay, all right.
Team leader, can we proceed with the D?
Okay, yes, proceed.
I'm checking the pupils.
Okay, pupils is equal bilaterally.
Team leader, pupils equal bilaterally.
Okay, very good,
Checking for
Zaizul.
the facial bone, any emphysema, any
Any depression?
Nothing.
any active bleed. Checking for the chest and upper limbs, any fracture over the upper limb, left and right.
Okay, seems like there's no fracture of the upper limb. Okay, the chest tube is still functioning,
Yeah,
bubbling,
chest tube is
right?
functioning, bubbling.
So let's proceed with our lock row examination, right?
Okay, we'll do team leader.
The penetrating, there's a bone penetrating from here,
Okay,
there's a
we'll do.
chest tube here. So we have to turn the patient on your left, right. Okay, so Zaizul will examine the back.
You'll be in.
Zaizul, you are taking care, Rizal, you are taking care of the head.
Okay, team leader.
Make sure the ETT is not dislodged. I will take care of the chest tube, okay? While
Okay,
Zaizul
team
examines
leader.
the back. Okay?
I was
Okay. Alright, can you please hold it? Yeah? Block row here.
Okey, dengan kiraan 3, pusing ke arah kiri saya. 1, 2, 3.
I'm checking from the head. Is there any swelling, hematoma, open wound over the head?
There is no open wound.
No open wound over the head.
See.
Team leader, cervical, any cervical emphysema, step deformity over the cervical region.
There is no step deformity over the spical
Thoracic
or
region.
anywhere along the spine.
Okay, is there any wound?
There is no wound,
on the
sir.
posterior side.
Yup.
Okay, checking for anal tone.
Anal tone is present.
Okay, the prostate is now high riding prostate.
Prostate is normal.
Okay, team leader, there's no obvious abnormality found during the lock roll.
Okay, good. So no other bleeding anywhere else. Okay, we're going to turn back the patient on your count result.
Okey, dengan kiraan saya letak patient balik. 1, 2, 3.
Very good. Okay, slowly, gently. Right. Okay. All right. Let's go back to our airway, please. Okay, airway right now, ETT is secured,
Yes.
connected to the ventilator.
Yes, team leader.
We are doing
Ready.
suction regularly, clearing the secretions from the airway oral cavity. So that's done. Next, proceed with B. The trachea is now central. The chest tube is in. Chest tube is bubbling. There's a bit of blood products there. We are still waiting for the CTC and the surgical team to come. Right.
Okay.
Now, how's the air entry now? Can you just check back the air entry?
Checking the entry over the chest.
Okay, equal air entry.
Okay, team leader equal entry.
And the heart
over
sounds
chest, and
also?
the heart sound itself.
Okay, distinctly heard.
Very good. Okay, let's proceed with the abdomen. Right, okay.
Checking for the abdomen. Okay.
Abdomen, is it soft? Advisor, what do you think?
Is it soft?
Soft,
no
yeah?
swelling, no guarding.
Right, okay, come let's check the peripheries. Is the peripheries coolish, warm?
Checking the capillary refill time.
Still, but better than just now.
Right,
Okay,
okay.
improve as compared to previously, team leader.
Okay, very good.
The pulse
Advisor.
volume.
Pulse volume is borderline normal.
Okay, very good. It's slowly picking up. Okay. How's the capillary refill time?
2 seconds.
Right, very good. Okay. So the pelvic spring.
So, Saiful, can you give me a actual history from the relative and also the paramedic that brought the patient here?
Okay, Doctor.
Okay.
I'm here from the clinic, so, okay? Alright. Right, checking over the top here, any bleeding, any laceration? No. Okay, apart from the abrasion I'm seeing right now, is there any active bleeding?
As you can see.
Okay, there's no active bleeding here. Okay, how about the periorbital here? Do I feel any crepitus, any bone deformity?
No.
Okay, Yo, can you give me a transport, please?
Okay,
I'm
give
looking
me a
over the
transport
eye.
now.
I'm seeing again the pupil size. How is it?
Reactive 2 millimeter.
Okay, is there anything intraocularly, any bleeding, any hyphema?
No.
Okay, I'm moving downwards towards the nose here. Do I feel any crepitus, any active bleeding?
Negative.
Okay, any septal hematoma?
No.
Boleh? Okay, Yo, can you do cervical inlet? Yes. Okay. Alright. Okay. Saiful, can you have Dr. Yo here? Can you get me the online already? Yeah? Okay. Is there any special time? No. Okay, can you get the auto okay?
Normal, no body.
How about this side?
Normal, no body.
Okay, Professor, can we reapply again? Sorry, let me just check the neck region here. Is there any active? Ini boleh letak gauze lah, Professor. Dekat sini letak gauze. Okay, can we reapply the cervical collar? Yes, Tamara. Okay. Okay, so I'm moving downwards over the clavicle region here. Is there any deformity that I feel? Okay. I'm moving downwards here. I'm just seeing multiple abrasion wound. Is there any active bleeding I'm seeing?
No active bleeding.
Okay, how about this one? There's no deformity or crepitus that I'm feeling? Okay.
Deformity over the forearm.
Okay, there's a deformity over the forearm. Is there any active bleeding over there?
No active bleeding.
Okay, Kausa, if possible having a close fracture over the forearm, can you apply a screen for me, please?
Okay, Doctor.
How's the pulse?
Aku tolong pada patient, Doctor.
Okay, Kausa, get a screen over here. Kausa, cuba tengok tempat yang tadi tu ada bleeding ke tak ada? Find a screen, please.
Ada pas?
Tengok, alright.
Okay.
Okay, I'm moving towards this side. Is there any deformity that I feel? Downward here?
Normal.
Okay. I'm checking over the pelvic region here. Is there any bleeding?
No bleeding.
How about the lower limb here?
Normal.
Over the toes here? Okay, apart from the bleeding that already secured just now, is there any more bleeding down here?
No.
How about the toes and foot over here?
Normal.
Okay. Okay, Doktor, tak apa. Okay, sama Doktor. Okay, guys, can we cover up this patient again? Okay, Doktor. Okay, what's the vital sign now?
BP is 100 over 65. IMIREX is 95.
Okay, guys, good job. Patient still stabilizing while waiting for the surgical team, orthopedic team, the primary team to arrive. I think we can order some extra adjunct for this patient. So we can order CT brain for this patient.
Okay,
This
Doctor.
cycle for this patient. Can we also order chest? Ada X-ray of the right forearm. Okay.
Doktor
And also
Maya.
X-ray over the right femur
Doktor Maya
and
nak
right
saya
knee
update
for
dengan
the...
family members?
Sorry?
Nak saya update dengan family
Yes,
members?
thank you, Saiful. Can you please update the family members? Okay. I think that's the body that we need to extract just. Okay. Continue the blood transfusion as well, the 1 normal cleanse. How's the vital sign now? Okay, patient Okay, doctor, continue the partisan monitoring. Alright. Okay. So for now, this gentleman is alright, which already corrected with the blood transfusion and warm saline that we're running in. Also, patient GCS was low. Possible of head injury, we already intubated for airway protection and informed the surgical team to have their input. We still unable to rule out the cervical injury if you have a low DCS, okay? So we already the CT cervical just to make sure this patient also having right tension pneumothorax. We corrected by doing a medial thoracostomy and also put in a chest tube for the right side. Okay, and inform the surgical team for their input. Also, patient also having a penetrating wound injury over the right femur. We stabilized the penetrating object and covered with antibiotic and informed to the orthopedic team also. He's on the way. And on open of secondary survey examination, we also noted that patient having possible close fracture of the right forearm, which already applied skin and also we related to the orthopedic team.
Good. Dr. Azim has some question.
Okay, team leader. Yes. So, what is layman law for the basic airway assessment?
Layman is the 5 criteria that we have to look for before we intubating for anticipating difficult airway for this patient. So L is to look externally. Is there any patient like very obese or very short neck? Then we expect the difficult airway. And then E, the evaluation, the 332 rules, the in between incisors, 3 between the omentum and the higher point, and then 2 is between the chin and the thyroid here. Alright. Also, M is the Malampati scoring. O is that we look for any obstruction over the airways. Like for example, we want swollen edematous over there. They want to anticipate difficult airway. Also, N is the neck mobility.
Then, what is the estimated blood loss in the single long bone open fracture?
For single long bone open fracture, the blood loss average about 2.5 liter.
Thank you.
Okay. Share your team.
Okay, teams. Looks like we're doing a very good job. The patient is stabilizing. So thank you very much. Okay, keep it up, guys. Yes, thank you.